Well, Josh Stein today making his first visit to Charlotte as North Carolina's new governor.
Stein was here to announce a new executive order aimed at protecting patient privacy when it comes to abortions.
WCNC Charlotte's Julia Kaufman joins us live outside of the Government Center in Uptown. Julia, what does the executive order do?
Well, Governor Stein has a list of directives for state agencies that aim to really protect the privacy of women and for women who are seeking help, ensuring that they get accurate information.
There is some information that the General Assembly has required clinics to provide to the state when it comes to an abortion. I want to make sure that the women of North Carolina know that we are going to do everything in our power to protect that privacy.
2 weeks in office, and Governor Josh Stein says one of his first priorities is to ensure protections for abortion providers and their patients.
There are other states that have passed bans on abortions and seek to come into North Carolina and govern the behavior of medical providers in this state.
His executive order tells state agencies to review and revise policies regarding how they store private patient information.
What records they're keeping about women's health care, whether they are storing them safely, and whether we even need to retain them in the first place.
The directive comes as Dr. Catherine Ferris with Planned Parenthood says privacy concerns are growing.
Patients regularly ask me whether the information I'm putting into their medical record is going to be visible to somebody else.
The order tells agencies not to cooperate with any efforts to penalize or prosecute doctors or patients for performing legal abortions.
They do not need to worry that the state of North Carolina will somehow assist law enforcement in another state to reach into North Carolina for having done something that is legal in North Carolina.
In 2023, North Carolina's abortion law changed restrictions from 20 weeks to 12 weeks, except for rape, incest, or the health of the mother or baby. It's unclear if the new legislative session will bring any new attempts to change the law. Stein is also directing the Department of Health and Human Services to put out information that details the differences between licensed clinics and pregnancy crisis centers, including privacy laws. For now, we're live in Uptown. Julia Kaufman, WCNC Charlotte.
A big topic dating back years here in North Carolina. All right, thank you, Julia.